Okay, I'll call the special regional council meeting to order. Please be advised that today's meeting is available for the public to attend virtually and is being streamed and recorded. Can I get a motion, please, to adopt the agenda? Moved by Councillor Gerwing, seconded by Councillor Roper. All those in favor? Blackie, Regional Health Advocate, your progress update. It's good to see you, Mr. Blackie. How have you been? Oh, you're muted.
As soon as I unmute myself, I'm fine. And hello to everybody, and hello to council today.
So, Mr. Blackie, if you'd like to begin your update, I guess. We have in front of us a sheet today that just says Project Update, Regional Health Advocate. So, yeah, I'll let you go ahead.
Great. Well, yeah. Well, thank you, Your Worship, and councillors and staff. It's great to join you this morning or this afternoon now, and provide a bit of an update on some of the work that we've been doing around the Regional Health Advocate project. So we have provided you with a summary document that gives you a sense of how we're progressing against some of the deliverables that we've set out with council. So we have over the last month been able to clarify that with yourselves as well as with staff. And we've started engaging with key stakeholders, regional council and NRRM staff, and community people to really start to get an idea of what the current status of the health services are in the Northern Rockies, but also to get an idea of the vision. So what is it that we collectively want to see in terms of health services in the Northern Rockies? So we've, as I've said, been able to engage with regional council, Save One, which is coming up later this week, as well as staff. And we've also engaged with a number of folks in the community. We're looking, I think at the moment, about 15 people in terms of the community, as well as regional stakeholders. And we're doing a bit of a combination of one-on-one interviews, like half-hour appreciative interviews. And for folks that, are quite busy or have tight schedules and we haven't been able to book a meeting with them, we've put together a survey, an online survey, which essentially asks the same questions. So this will all go into our emerging database of ideas and innovations and vision toward the type of health services that people are wanting to see. Part of this as well as you know, is validating the community health plan's priorities that were articulated 3 years ago, but also we're beginning to surface, I believe, some new ideas. So we've begun to take the input that we're getting from the various people we're talking to and will continue talking to over the next week or so, and have compiled a bit of a thematic analysis. I'm happy to share that with you if you want, but I believe I need someone to give me permission to share my screen at this end. But I'll show you the type of analysis that I've been doing and where some of the themes are starting to emerge now. Perfect, great, thank you. That was Celine, remember? Let me just see. Now this may be difficult to read, I'm not sure. But what I'm doing is I'm doing a qualitative analysis of the interviews that I'm undertaking. And again, I apologize if this is a bit hard to read. You might be able to zoom your screen up a little bit. I can't make it much bigger at my end, unfortunately. It's a full screen here. But this will give you an idea of some of the themes that are emerging. So as you can see, for each comment or idea that have come out of the interviews that I've done with people, I've created essentially a sticky note, electronic sticky note, and then begun to classify them. So transportation and the need for transportation to access services due to centralization is one of the predominant concerns. No surprise there, I don't think, but that's definitely a theme that's starting to emerge. The relationship between the community and Northern Health is another theme that has emerged, as well as the hospital. And I will say that the hospital comments predominantly, and those about the physicians in the community predominantly, are exceptionally positive. I think there's a lot of pride, but there's also a lot of maybe relief that the services that you do have in the community have historically been and continue to be good as it relates to the hospital site. So this idea of personalized service and being able to get a quick appointment with the physician when you need to talk to them. So that's a theme that's also emerged. Maternity is there. A lot of people have talked about maternity, and again, not to get overly concerned about the number of stickies. It's really more of a qualitative piece. We haven't really weighted them or anything, but maternity is a huge issue along with transport, and they're kind of tied together, as you know. Ultrasound, CT scanning, diagnostics, we're seeing that. Again, no surprise. Virtual care has been talked about. I've created a bucket that I'm calling strategy, which is really around how can we go forward and how should we be advocating for some of these services. And there's been some interesting ideas that have come forward. One of the people I've talked to talked about the 911 process and how you've partnered with other stakeholders to get 911 support for the Northeast. But also this idea of sustaining the health services that you have, as well as advocating for new services and being able to find a balance there as well. And then just some general comments as well that, people, there's some political comments there as well. And that, can we ever overcome the inequities potentially because of geography and those sorts of things. Recruitment and retention has been talked about a little bit. As well as the coordination of care. And some of these themes, as I mentioned, sort of intertwined with each other. So this idea of coordination of care, that if the health system is better able to coordinate care, maybe we don't have to travel so much, those sorts of things. So that's kind of, some of the early work that we've been doing. As I said, we've got some more interviews coming up. We're doing this analysis. And then what we want to do is pull together the people that we have been talking to, as many as possible, for probably about a half day, maybe 2 to 3 hour Zoom workshop where I'd like to, get people really thinking about and looking at some of these themes that have emerged. And again, this idea of co-creating a strategy that the community stakeholders and regional council feel and believe and do have a role in establishing, because it's not all about, having a single consultant who's out there figuring out what all your concerns are. You need to tell me what you're doing through the interviews, but also to prioritize and to be able to think through, what some workable strategies might be that then we can bring back to regional council for your review as our sponsor on this project. So those are the things that we're working on in the moment. I have made some contacts outside of the Northeast as well. We've been speaking to organizations like the Rural Coordination Center of BC, as well as the Doctors of BC and Northern Health. So again, setting up some interviews there, talking to people about what we're doing and getting their ideas. And then going forward, we've also just this morning had some preliminary connection with an organization called the BC Rural Health Network, and they've pulled together some data actually from Ontario on rural transport. I haven't had a chance to look at it yet, but again, there's so much out there. And as we're finding, there's also material that I'm discovering that you may already know about. And so we've had a couple of conversations over the last couple of weeks about that, where it's like, hey, I found this great study, and they're like, yeah, we have this, and so that's okay too, because, it's all a process of discovery. So so it's busy. We're I think moving forward against what we've been asked to do in the first couple of months here anyway. And I must say that everyone I've talked to has been excellent. I think there's a real sense of place and a sense of pride to the people that serve on council, but also the people who are leading health and social services in the community as well, that it's a very tight community. It comes across as a safe and connected community. There's so much going for Fort Nelson in the Northeast that it's humbling to see, and I think it's a really great reflection on the great work that's been done in the past, and of course the great work that you're going to want to keep doing as well. So that's my update. In terms of some of the work that we've been doing, I'm absolutely open to any questions or comments about the report that I provided or the analysis that we're doing, or just in general. I'm happy to entertain that now.
Councillor Gerwing.
Doug, can we get a copy of that sticky document that you presented?
I'm sorry, Councillor Gerwing, which document was that?
The one with the yellow stickies.
Oh, sure. Yeah, absolutely. I can, it's draft at the moment because every time I do an interview, I'm adding a few more stickies and thinking about it a bit more. But yeah, I'll flip it to Jaylene as soon as we're done, and then she can circulate it with you with the understand. I'll put a draft on it that it's a work in progress, but
Yeah,
hopefully.
for sure, I understand that. I just couldn't see it on the screen. So
Oh, yeah, sorry about that. And I'm hoping that each of you will see your ideas represented there. And if there's anything that's missing, you know, that's exactly this process to let me know. So, but definitely I'll send that off to Jaylene and get it distributed to you.
Thank you.
Are there any other questions, councillors? Can't see any of the other councillors on the screen.
No questions over here.
Thanks, Kyle.
You're good, Councillor Andrews? Councillor Souls, Councillor Roper, any questions?
No question.
No. Councillor Gerwing.
So Doug, can you share with me anything that you learned that was a complete surprise to you?
Well, that's a good question. I think what I've seen, which I mentioned briefly in my report, is the great degree to which people are appreciative of the services you do have and how important it is to sustain those. And so what I've heard over and over again is the excellence of your primary care services, your 5 physician services, and how they support you, how they support the community, and how they support the hospital. I think the other piece that I've heard, I'm just quickly going over my notes here in terms of something that really stands out. I mean, there's the usual concerns and issues, but I think there's also a sense of the ability to maybe change the conversation with Northern Health and to change the conversation in a way that is more, and this is very early sort of thinking that there may be an opportunity to, you know, to create more partnerships and some of the things that we've talked about. But for the large part, a lot of what I've heard, Councillor Gerwing, has been validating, I think, what I've heard in the past and certainly read in the, you know, in the community health plan and other documents.
Okay, Mr. Blackie, I don't see any other questions here from councillors. I guess, you know, when I saw some of the things up on the stickies, I guess I had a few questions, but I think I'll leave that until your yellow stickies are done, and then I'm sure we'll have a conversation about some of the things that, you know, some of those might fall off and some of them might get reinforced, so I don't want to get ahead of ourselves. There's nothing else I have. Councillors have no more questions.
Foster, if I could, Mayor Foster. Sorry, I'm just still processing Councillor Gerwing's question. If I may go back, I mean, one of the things that has emerged to me is this issue of problems versus symptoms, and to a large extent how the inequity that's been identified by regional council drive a number of the health concerns and health service concerns. So again, it's I guess as part of a learning for me is, yes, there's a long list of things that you need, but why do you need them? And a lot of it has to do with the fact that through the centralization of services, there's been a considerable cost, both in financial and human terms, that has been transferred to the people of the Northern Rockies for care. And so I think for me, again, I'm beginning to think through this just in terms of, you know, the proposed strategy, is what do we really mean by inequity, and what does it inequity and inequitable access to healthcare, and what does that mean? And then, you know, what are some of these costs? And even When you're looking at the maternity cases, for example, that are sent to even Fort St. John, let alone Prince George or Vancouver, if you just multiply the number of cases by the number of hours it takes to drive to Fort St. John and back, we're dealing with hundreds of thousands of dollars that essentially come out of the pockets of families in the Northeast. So it's those sorts of arguments, and a number of you have reflected that there's the costs and the funds that come into the community, but there's also the funds that go out of the community that are being borne by the citizens of the Northeast, and trying to correct that inequity, I think, may go a long way toward addressing a number of those service concerns that come out. So again, it's a bit nebulous, but that's sort of where the thinking is, and those themes are starting to emerge. So as I complete the interviews and do a few more, and we have an opportunity to refine the analysis a bit, it'll be an iterative process. So your feedback from the council level is absolutely welcomed in this early draft stage, and then we want to also take it back to the people we've talked to and say, does this tell the story? Does this reflect what you believe to be concerns in the Northeast? So thank you, Mayor Foster, for letting me to have that one little thought.
You bet. So, I mean, all those points that you brought up are nothing new to the councillors around the table about, the costs of medical travel out of the community, which has been a big issue. And of course, the inconvenience, et cetera, and the maternity care and the cancer care and, physiotherapy and all those things. But you're right, those are maybe putting some color on the outlines of this entire advocacy project here. So, okay, any further comments? Yes, Ms. McIver.
I was just going to note that he's kind of to his interviews, and one thing that's abundantly clear is that the conclusion we've come to that mental health is so vast that it's not that you can. So our last conversation, have you seen this? Oh, I have. Well, have you seen this? Oh, no, I haven't. So we're swapping back and forth reports and links and agents. Then it occurred to me there's probably, there's results of surveys that we've done and reports we've heard over the years that now I'm sharing back after, I'd sent what I thought was an inclusive list of documents for him to review. So, the statement of it's all a discovery, it truly is. And I don't know that you're anyone all there is to know. It's just
And I suppose as time goes on, those reports and things change in the healthcare system and improvements are made or things get worse, those reports become less and less valid as time goes on, and then new reports come out. Councillor Goering.
Thank you so much for highlights for me my most recent thinking on the cost of that's what started this whole thing is one person can't possibly up, 7 people can't possibly, because there is so much information out there and there's money associated with each and every one of these reports. Oh, if a person was even able to gather all of the reports in one place and give it just like an estimated dollar value, I mean, the cost is astronomical. So it's like really, and I think that and I'm really glad that Doug got this too, is that costs haven't been reduced to the province. It's just down to the patient or victim who's there. And so it's so much more about just thinking it's not necessarily, our solutions aren't going to be addressed with increased dollars, right? It's going to be a reassessment of how the dollars are spent. Like, in what world is it okay to be spending all of this money on studying a problem, but not giving any money to the problem? Seems so simple to me. I just don't understand. Like, how do we get to some sort
Maybe if they had to put the money for the studies into giving us more staff in our hospitals, we might be better off. Anyway, are there any further comments? Very well. I think I'm about to give you back 40 minutes of your day, Mr. Blackie.
Much appreciated, Mayor and Council.
Very well.
Yeah, thanks again for the opportunity to check in. Each of you has my email and my contact number. If you want to give me a call, I'm more than open to that, and we'll be seeing you soon, hopefully.
Thank you. And with that, we are adjourned.
Thank you. Bye, everybody. Have a great day.